All right. Good afternoon, everyone. Aloha, taloha, and welcome. It is so wonderful to see all of your familiar faces or names, I should say, on this happy Aloha Friday. We hope you're all wearing green as it is also St. Patty's Day. I remembered my green. So welcome, welcome. I'd like to first start off by saying this training is being presented by the NHPI 3R. We are a collection of more than 60 agencies, organizations, and individuals working collaboratively to address the pressing health concerns of our Pacific Islanders and Native Hawaiian communities. Please know, I'm going to do a little bit of housekeeping first and foremost. This webinar is being recorded and live streamed. Also, if you have any questions, please post them in the Q&A box. While we try to monitor our webinar chat, it actually makes it easier if you can put it in the Q&A box. So please do that. For those of you who are part of our live stream, you can put your questions on Facebook, and we will include them during the Q&A section of this webinar as well. So I want to start out by saying this training is to prepare CHWs or community health workers, outreach and eligibility workers, and other frontline staffers to have the knowledge and capacity to best assist their clients through the redetermination process. So today's presentation features two representatives from the State of Hawaii MedQuest office. We have Meredith Nichols and Puanani Crabbe Parker. And I'm going to tell you a little bit about them. So for Meredith Nichols, she began her role of Assistant Administrator, Deputy Medicaid Director for the State of Hawaii MedQuest Division in 2017. Meredith earned her master's degree in American Studies from the University of Hawaii at Manoa. And she has extensive experience in community building. So mahalo for joining us today, Meredith. And then her partner is Puanani Crabbe Parker, a co-worker, of course. And Puanani joined the State of Hawaii MedQuest Division's new healthcare outreach branch in 2015 as a coordinator. And in 2017, she became the healthcare outreach branch manager. So it's awesome to have her here also. Puanani is a graduate of Kamehameha Schools and earned her bachelor's degree in business administration from the University of Portland. So mahalo to you both for joining us today. What the run of show will be as follows. They're going to do their presentation. After they have completed their presentation, there will be a Q&A portion of this webinar. So again, put your questions in the Q&A box or put them in the live stream chat, and we will be sure to ask them when that portion comes up. So I'm going to go ahead and turn the time over to Meredith and Puanani. Thank you, guys.
Mahalo, Telly. Really appreciate it. Aloha, all of you. So happy that you're able to spend some time with us together on this Friday. It's kind of a lengthy slide deck, but we hope to speak through it kind of casually with all of you. And the goal here really is we don't want to like jam a bunch of information at you, but rather we want to try to communicate in a way that makes all that's going on understandable. We want to leave lots of time for questions. So I think we're ready to go. Puanani, did you want to add anything before we start?
No, all ready.
All right. Just wait for this deck to come up and then we'll get it going. Perfect. So again, mahalo. And we are here today to help share a little about our, I just realized I'm color matching with our slide deck. I didn't plan that, but there it is. This is our Stay Well, Stay Covered campaign that talks about our restart of Medicaid renewals. Next slide, please. So we wanted to start with just some context of where we are as a program. Medicaid, we have lots and lots of people right now who are reliant on Medicaid for their health insurance. This slide you're looking at here just shows you the volume of applications we've received from 2019 through current year 2023. And what I want you to notice is the green line is what we would call our normal state of being, right? Before the pandemic. That green line is how many applications we would get on average in a week. And then the numbers are, of course, over here, yeah? So there's that green line. And then if you look 2020, all of a sudden in about March, when the pandemic really started to impact our shores, you see this uptick in the number of applications. People are scrambling. They've lost their employment. They've lost their employer-sponsored coverage, and they need health insurance. So in that year, 2020, lots more than normal applications coming in. Puanani will talk us through later. At the end of the year, you always see that spike, and that's because of the health insurance marketplace. So just spoiler alert, Puanani is going to spend a lot of time talking about the health insurance marketplace at the end of our slide deck. But I just wanted to give you that context, and then especially point out after 2020, we start to see this interesting decrease in the number of applications, right? This red line of 2021. And then 2022, an even further decrease. And here in 2023, even below that. So why fewer applications, right? Next slide, please. And just to show that this is not a phenomenon on one island over the other. We keep track, and I know it's really hard to see when we look at Molokai and Lanai because it's so small at the bottom in terms of volume, but just to show you that the volume of applications are pretty mirrored island to island. Next slide, please. And this is why we think applications have decreased. As we look over time, pretty steadily, MQD or MedQuest has covered just over 325,000, which is still a lot, right? That's 1 in 4 people in the state of Hawaii. And then here we get to March, and you see this uptick and continuing uptick over the past 3 years. So now our total is 467,129 human lives covered by MedQuest. That's 1 in 3 people. And it represents a 43% increase in the number of people that are being served by MedQuest. And part of the reason for this is because the Fed said, hey, in March of 2020, you know what? Pandemic. Do not, if people are on Medicaid, please do not disenroll them. Just keep them on Medicaid. Don't do their renewals, just like let them ride on Medicaid because it's a pandemic. It's the worst time for somebody to not have health insurance. So please keep them enrolled. So that is what we've done. That's what states were permitted to do. And we have done that. So these are all the people that are continually enrolled. The slide I want to show you next sort of explains this a little. Next slide, please. So I know it seems random in the middle. We're talking about Medicaid, and now I'm switching to the economy and the unemployment rate. What I wanted to point out is if you look just at the right-hand side of the slide here, right before that big uptick, guess what? Guess what month and year that is? That is March, April of 2020 is when our unemployment rate went from being really low, 2.2%, and then all of a sudden the massive job loss we all know about. So then this spike in unemployment, right? Spike in unemployment. And since then, unemployment has gradually come back down. We're still not fully recovered to where we were pre-pandemic. We're at about 3.6 now, but still well better than up here at the peak when it was 22% unemployment, which is huge. We went from having the best unemployment rate to having the worst unemployment rate in the nation. And if you could just press click for this animation. So this little purple line, excuse my hand drawing, but this little purple line is just showing you that comparison of MQD enrollment. So what we see is we spiked up along with the unemployment rate. The difference is while the unemployment rate has come back down because of continuous enrollment, we continue to have people who maybe have since become employed, but still, things are rough, things are hectic. People aren't always going to remember like, oh, wait, I have my job back. Oh, I have employer sponsored coverage again. Well, I don't need my Medicaid anymore. Not everybody is going to remember that, right? I know my friends and relatives, that's the last thing they're thinking about. They're just trying to catch up on bills, take care of their ohana. So I just wanted to show you that comparison of our enrollment spiked at the same time, but we continue to be high, whereas the economy has started to recover. Next slide, please. And then I also just wanted to make sure you saw county by county what that looks like. So we see, and again, this is also very interesting, right? 44% increase both on Kauai and Oahu, but a 47% increase Maui County. And then a 37% increase on Hawaii Island, but yet they covered 95,000 people. So there were many people proportionately already covered on Hawaii Island. Lava inundation just directly preceded the pandemic, right? So hit after hit for Hawaii County. Next slide, please. All right. So I'm going to introduce this slide and then I'm going to start to take turns with Puanani here. This is kind of a lot of information packed into one slide. So what we are here to talk about today, now you have kind of that foundation, that context of who's on Medicaid, why is it a big deal? There's a lot of people, 1 in 3, right? So what we wanted to share is the Consolidated Appropriations Act of 2023 that was passed in the last days of last year, just only 2 months ago, really, if you think about it. That act said, you know what? I know that during the public health emergency, all Medicaid programs were continuing to cover people, but this act said we're no longer going to link that coverage to the PHE or public health emergency. We're going to separate it, decouple it. We're going to say from now on, we're just calling it. All the states are going to restart no later than April, renewing their redeterminations of Medicaid eligibility. And so that's what we are doing now. We're scheduled to restart in just a couple of weeks, that redetermination. This is really critical to know. Renewals are going to be divided over an entire 12-month period. So it's not like, oh, April and all 467,000 people are going to be redetermined all at once. We cannot do that, right? There would be no way. So that total amount is divided evenly across 12 months so that we can manage the workload. And while it's divided, people will be able to remain continuously covered until their month, the month that they're assigned to go, and then we'll redetermine their eligibility. And in general, the oldest cases are going first. Like, you can imagine we haven't done this for 3 years. So maybe some cases, they haven't been redetermined for 4 years, but maybe other cases were determined a couple years ago when they first applied. So the oldest, most outstanding ones, those will go first, and then it'll line up from there. The last paragraph, especially for all of you gathered on this call, we're trying to spread the word. Yes, there's this kind of distribution over 12 months, but we made an exception for anybody that is known to our system as being houseless. We purposely took anybody with any kind of indication that they were houseless, and we moved them to the very, very last month, which is March of 2024. So it's another year from now. So they'll be protected until then. But anytime along the way when any of you might be, working with somebody in this community, and you know how it is, it's hard to reach people, right? They're not going to get a letter because they don't have a stable address. So whenever one of our community partners, anybody is engaging, where we recommend now is a good time. Now is a good time because from today, you renew eligibility, they'll be good for a whole nother year. So for anybody who's in that houseless situation, we really recommend that. And you can do that just by, you have the member with you, you call us at this phone number, list it down here, and we can start to work that case to redetermine eligibility. Next slide, please. All right, Puanani, take it away.
All right, so just some quick facts to run through with all of you. Again, beginning in April 2023 and continuing through March 2024, MedQuest Division will begin to review all of our Medicaid cases. All of our Medicaid households are going to be receiving in late March, so it's already kind of late March, mid to late March, and that letter will come in a white envelope and white paper, and that will let every Medicaid household know when their renewal month is going to be and what month they should be expecting their letter to inform them. Renewal months again will be between May 2023 and April 2024, which is why we say we're starting in April, but nobody is going to be terminated in April. That's for us to start going through all the files, doing our outreach, sending out letters, making phone calls, sending emails, trying to get in touch with members where we may need information from them. So again, Medicaid households will be receiving a pink letter in the mail the month before their renewal month. So in this next example, if Auntie's renewal month is December 2023, she's going to be receiving a pink letter in a pink envelope in November of 2023. We encourage all of our Medicaid members to take the following steps to help prepare for their renewal. Many of you who maybe are part of our community partners have been hearing this message from us for a very long time now, a little over a year. Again, making sure that if members in the community no longer need their Medicaid coverage, make sure they call us and let us know. They can call us at the 1-800 number. They can visit our community partners and help, we can help them call in and terminate their coverage. Also, making sure that all Medicaid members have their current address, phone numbers, emails, and any other contact information updated and current with us at MedQuest. The easiest way to report these types of changes is to be able to contact your membership, your health plan. And the best way to do that is on the back of their membership card, they can call their health plan member number and report the changes to their health plan. Members can also go to our website at medquest.hawaii.gov for ways to reach MedQuest directly. And then again, please encourage all of our residents who have MedQuest. Make sure you're looking out for your mail. Anything marked MedQuest, please open it, read it, respond if need be. And if you don't understand what the letter is saying to you or what you need to do, or if you need to do anything at all, bring it to MedQuest, take it to our community partners. We can help read the letter and figure out what your next steps will be. Next slide, please. Ooh. All right, so we have some frequently asked questions for this redetermination, and we're going to go through some of them with you. They're not all of them, but we felt it was a good time to run through some of these FAQs. So number one, what is the public health emergency and how did it affect members? So again, at the beginning of the COVID-19 pandemic, the federal government declared a public health emergency called a PHE. During that PHE, Medicaid agencies like Quest Integration, our Hawaii's Medicaid program, did not disenroll members, even if somebody's eligibility changed. In December 2022, Congress passed legislation which decoupled the Medicaid continuous coverage requirement from the COVID-19 PHE, and instead directed the continuous coverage requirement would end on March 31st, 2023, regardless of whether the PHE dates continued on or not. And then number two, what can members expect when the renewal process begins in April 2023? So the notification process is going to start in April of 2023, just next month, and it'll be spread out over 12 months. Because of the sheer number of our current members, not all members will receive notification at the same time. Again, those notices that are going out in March, we'll let them know when their renewal month is. And member renewals have been divided evenly across this 12-month period. Next slide, please. Would you want to take turns, Meredith?
Yes, that way we can breathe.
Okay, thanks.
So for this one, it's kind of a big one. And we try to highlight the kind of important things to make it easier on your eyes. What can members do to prepare for renewal? But before we continue, I'm sorry, I meant to unpack the word members. So if some of you might be looking at it like, why are they talking about members? Who are members? So members are people who are covered by MedQuest, covered by Medicaid. So why members? Because, you know, sometimes folks will call them clients or customers, or we've all heard beneficiaries, many, many terms that all boil down to the person we're here to serve, right? And nationally, there's a group of people who are enrolled in Medicaid on this Medicaid Health Advisory Committee. And through their direction, they said, we don't want to be a client. We don't want to be a beneficiary. We want to be part of this. We want to be members. So it was defined by Medicaid members themselves that they prefer to be called members. So I just realized that as we go through this, we're using the word a lot, and I wanted to make sure it made sense for everybody who's listening. That's why we are referring to all of our family and friends who are covered by Medicaid as Medicaid members. All right. So simple messaging, right? What can you do to prepare? Update your contact information. The best way to do that, and we're so grateful to the 5 health plans that work in partnership with us for taking all any kind of contact information changes. So we ask people just look at the number on your health plan card and please call your health plan to update your address. It's kind of biggest bang for your buck because boom, you're updating the address with the health plan, but then also the health plans graciously provide us at MedQuest a file, a regular file with any changes to member contact information that we can then upload into our system so that the members only having to call one place, the health plan, but we get to change it health plan side and MedQuest side. We also want to tell people, like, because you saw that chart, right? That economic chart. We know that many of the people will probably no longer need coverage. And if that is their case, no shame, they can call anytime. They don't have to wait for a pink letter. They just like, oh yeah, I forgot I do have MedQuest. Let me call and let them know I don't need it anymore. So we're happy to take that call anytime, only because it helps, you know, right size the work moving forward. Yeah. And of course, no pressure. If people need MedQuest, we don't want them to call and tell us they don't. We want people to stay insured. And then, of course, starting in April, being on the lookout for that pink letter, you know, we wanted to make sure it stood out. This is really important. So we changed it so that beginning in April, all communications from MedQuest will be in pink envelopes on pink paper, so that it'll stand out in the tons of mail people get in their mailboxes. We also want people to know pink doesn't mean bad, right? Pink is just important. It's a communication. That communication that Auntie gets could say, okay, Auntie, we were able to renew your we were able to renew your Medicaid. You don't need to do anything else. You're good for another year. Thank you. Please, you know, take care and stay well. Or the pink letter might contain a paper that says, you know, we tried to renew your eligibility and we couldn't. So here's, we have some questions. Here's a form. Please either call us and help us answer these questions we have, or you can mail it in, you can fax it in, you can go online and enter information, you know, upload this form there if you want, but we need to hear back from you. So that's the one. As we think about what really needs to happen, if you get that letter that says we need to hear from you, we do really need to hear from you, because we don't want anyone to lose coverage who is still eligible for coverage. We want to make sure everybody who needs coverage and is eligible remains covered. Also, for people who might be making more money, they don't need Medicaid, but they still don't, for people who might be making a little more money, but they still don't have health coverage, we ask them to please go back and double check with your employer to see if you'll be eligible for employer-sponsored coverage. It could have been at the time of employment. You know, there's that stack of forms. A lot of times it's just post it, sign here, sign here, sign here, sign here. And people don't always, myself included, really pay good attention, right? You're just signing. But sometimes one of those forms is you're agreeing that you don't need health insurance coverage. So if this is the case, there may be an opportunity to say, hey, I used to be covered on MedQuest, but I'm not going to be covered anymore. Can I get coverage through my employer? Puanani can talk to us a little later after the deck about the state has a prepaid healthcare act, right? Which is very generous for employees. And most employers are required to provide without cost to their employee health insurance. So we want to make sure we're helping make that connection. And then also plenty of people have like part-time job here, there, or maybe I'm a musician. I don't have an employer. I don't have somebody to go to for health insurance. So but I make enough money where I don't qualify for MedQuest. We tell these people, healthcare.gov is the perfect source for you to have access to health insurance if you're not eligible for Medicaid. You don't have an employer to go to see if you can get coverage. You go to healthcare.gov, lots of good plans there. For us in Hawaii, we have 2 insurers on that. It's HMSA and Kaiser, and each of those have multiple different plans that are available. Next slide, take it away, Puanani.
All right, so when and how will members receive renewal notifications? So again, 1 month prior to their month of renewal, members are going to be mailed a pink envelope with a pink letter that will contain eligibility instructions. Like Meredith said previously, it may say, hey, you're all good, we've renewed you, stay well. It may say, hey, we need you to confirm all of this information and we might need further information from you. So we want to make sure those members are returning that information and paying attention to the mail. So again, we're going to be beginning to review all of our membership whose renewal months or renewal date is May. And if those members with May renewal dates are no longer eligible, their coverage may end as early as June 1st, 2023. Can my household renew at the same time, or will we receive separate renewal letters? With very few exceptions, MedQuest will renew the entire household at the same time. Number 6, can I continue with that same health plan when I renew? In most cases, yes, unless you have moved or your current health plan is not available in your new location. They will be able to stay with that same health plan. Next slide, please.
Okay, we're halfway there. We're halfway there. I know it's a lot of information, but there's only 11 FAQs, so we're on number 7. If it's determined that a member is no longer eligible for Medicaid, what happens? So what happens there is a member is going to receive a notice when their enrollment will end. And then there will be information in that letter on how to appeal that decision. If they think there's an error in that decision, like, no, I'm pretty sure I qualify, I think it's an error. It can absolutely be appealed. And then information about other healthcare options. And we talked about this just a moment ago, healthcare.gov. If a member is no longer eligible for Medicaid, where can they find healthcare coverage? So again, we say start with your employer to see if you're eligible for health coverage. Because oftentimes if people are not eligible for Medicaid, it could be because they gained employment, which is a great thing. But sometimes people don't know that they have that option with their employer. And sometimes they don't have the option, right? So check with your employer. If nothing there, go to healthcare.gov. We also have, and some of you on the call may participate in this. If you go to medquest.hawaii.gov/gethelp, there's a list of community partners. You know, sometimes people, like my mom, she doesn't want to go to a website to do anything. She wants to go talk story with somebody in person. So my mom would be one of those people who wants to know, no, I just want somebody to sit with me and help me. And for our members who have people in that, like my mom, they will want to go here and see who in their community could help walk them through this on healthcare.gov. And also for our veterans, there are good resources for healthcare at this link here. Next slide, please.
All right, so number 9, we're coming to the end. What is being done to reach members? So again, we've already started a mass media campaign. It's including ads in movie theaters, television, radio, public service announcements, which will be following soon. We also will be utilizing earned media opportunities and inclusion in community partner and legislative constituent communications. MedQuest will also be reaching out to Quest households with a plain white letter in March to inform them of the process and let them know which month their case will be up for renewal. Next slide, please. And here's the example. This is a sample of our March letter that we're going to be mailing out to all of our member households. Again, we've already said it many times, but again, we're telling the members beginning in April and continuing through March 2024. So again, expressing to them that we are going to be taking time and an entire year to go through this process, right? We're going to begin renewing and reviewing all of our Medicaid cases. And this letter to this household is going to inform them of when their household will be renewed and when they will receive their pink letter in the mail. So they will know, each household or individual will know what month their renewal month is and when they expect to get their pink letter. And then further down, it's, it provides our contact phone number and ways to take action if you no longer need health coverage from MedQuest, if you need to update your information, and what to do when you receive that pink letter and pink envelope. Make sure you open all of that mail and read it so you can be informed on what to do. And then if you receive a renewal form, make sure you complete it, return it, fax it, email it to us, call us on the phone. Sometimes the renewal doesn't always have to be mailed back. Sometimes the information we're looking for can just be a simple phone call. Next slide, please.
All right, last FAQ. And sorry, I'm trying, if you see my eyeballs shifting back and forth, it's like I'm getting buzzes in the chat. And I think, so some of those questions we're about to get to. So we'll, I think we have good answers for all of those. So stay tuned. I just wanted to acknowledge, I can kind of see them. So we'll get to those. How will you reach those who may not have access to the internet, like in rural areas? So this campaign includes messaging via printed and out of house channels, just meaning like things, newspapers, banners, paper, posters. The renewal notification is going to be mailed, so it's going to be paper, so that folks without internet access will still be receiving that information. And then, of course, talking to community leaders like all of you and making sure really at the grassroots level, folks are aware. When do we expect to complete the Medicaid eligibility verification process? So remember, it's going to take at least a year, right? So we're going to initiate the last batch of renewals in March of 2024, which means we're going to start to run them. And that's for cases that are up for renewal in April of 24. So for some cases, verification sometimes takes up to 60 days if there's a back and forth to complete. So if we think about all of that, the final verifications for all members should be completed by the end of May 2024. So that's the kind of mountain we're looking at, and preparing to walk it together with all of you. Next slide, please. All right, so one of the questions in the chat, and I was excited to get to this portion of our slides because, okay, the FAQs are done, but yes, spoiler alert, all those FAQs that we just made you listen to us talk through, they're all available on the website. And this is kind of that link for that. If you could go to the next slide, please. So when you go to medquest.hawaii.gov, you're going to see this as our first banner. If you stay on it too long, it does rotate to other banners, but you can always click on the left-hand side, and it'll go back to this. And you click anywhere in this Stay Well, Stay Covered, and it'll open up our webpage, our Stay Well, Stay Covered campaign for you. But right here at the top of our webpage, you see that we've had this here for a while, this important, are you enrolled? Please, this on our website, it'll tell people to call us to make the change. When the health plans are in the community talking about it, or we're talking in large groups like this, we tell people, please call your health plan. Or you can also just click on your account, because people have access to an online account for their Medicaid to make the change. Next slide. And go ahead, Puanani. Oh, unmute.
So sorry, I'm just talking away on mute. So when you go to that link that we provided, the medquest.hawaii.gov /stay well, it will take you to this area. And this is our banner page here. And if you could go, next slide, please. Now, when you scroll down from that page where it takes you to, you'll see all of the tabs here that we have information for. We have FAQs, and notice we also have translated languages of all of the FAQs and the languages that are able to be looked at. So if you click on the green links, say CHWs, you'll be able to have that list of FAQ question and answers in that language. Again, we are still working on some translations. And so as they become available, more will be added, but I think we're almost done. I just see, I think maybe a few missing still, or not quite, but
pretty full now. I think we're all
pretty full. Yep. Yesterday, I think we weren't seeing Ukrainian and Russian, and today we do have them. So yay. But these are the languages we've translated for our FAQs. And you can we really encourage all of our community partners to visit this site. Like, I would encourage my community partners to visit the site daily, because there's always new information, but at minimum weekly, just to keep up with what is going on with our process and this Stay Well, Stay Covered campaign and our renewal process. Next slide, please. There's also an example of that translated FAQs in our Olelo Hawaii language here as a sample. Next slide, please. And then, of course, we've posted our press release that we released on February 16th. And for those of you who may not have seen it, it is here for your information and reference. Next slide, please. We also produced a very short video, which we launched towards the end of 2022. We encourage our community partners to use this video. You can download it, add it to your website, to your social media sites, and use that as a source of information to your members. Next slide, please. And then the big thing here is our toolkit. Again, these are here for our community members, our community partners, to be able to use like I said, on their sites, in their flyers, online, in their discussions. We'll always have a current PowerPoint slide deck here on the left-hand corner, upper left-hand corner. And as we get new information and perhaps revise our slide deck, it will be posted there. Our video is here as well. And these banners where you can right-click to download and add them to your social media sites as well. Next slide, please. Also in this toolkit, you'll see a little further down in the toolkit, which says explicitly, please do not use these until April 1st. So when April 1st comes, all of our community partners as well could use the April 1st collateral that we have here as well. So we encourage you folks to visit this site, take a look at this, and see if you can incorporate that into your messaging to your members. Next slide, please. All right, and then our letters and notices. We have our samples of our March letter here that we previously showed you through the FAQs. They are in translated languages of the 6 languages that we've committed to having. the English, Chinese, Chukis, Ilocano, Korean, Marshallese, and Vietnamese. And also we have our translated renewal form or 1100B2 form. So you can use those as well. Our community partners that we work with, you know, when you're meeting with members and they speak a different language, it's always good. You could print it out and say, hey, be on the lookout for this March letter, you know, and this is what it's going to say. And you can help them with that by utilizing these links as well. So if we have anything new to add, they will be added to the tabs here. And then next slide, please.
Just wanted to note before
ahead.
you leave that slide, sorry, one more note, like for all of you, because you know, it's what's in the pink envelope, right? This is what's in the pink envelope. You see this 1100B, that could be if we need more information. So if you folks wanted to get a sense of what does that eligibility renewal form look like, you can just go here and like Puanani was saying, take a look. You can get that preview of what that looks like. Just know that when people receive it, it's going to be pre-populated. So it won't be just a blank form like it looks on the website. It'll be pre-populated with all their information to make it as easy as possible. So people are just confirming, yep, this is still correct. This is me, this is it. Or they can make a change. So they don't have to go through and fill it out from scratch. Sorry about that. And next slide. And we got all excited. We wanted to share with you. We see some people already starting to use the campaign materials. This is just a screenshot from the Hawaii SHIP. They deal with a lot of kupuna and Medicare related coverage. So they had a little thing on their website here. Next slide, please. And when you click on their thing, it was just more information that they gathered. Next slide. And Kokua Mau also did a drop in their newsletter. And I'm just showing this to all of you so that we encourage you, don't be ashamed. You can get the word out. We've got all the tools Puanani just reviewed with you on our website. So all the information, so go for it. You can put together whatever you want just to help, you know, help inform people. Next slide, please. And click. So I love this, right? This is, so Kumukahi Health, for example, and Puanani works with all of these organizations and gathered all of these materials. They're one of our Kokua organizations. So they put together this flyer for their, the communities that they're serving and all the collaborations you can see down there. Click. Also, KKV has something going on, again, using that same kind of language and making sure the folks from KKV who use services there are looped into what's going on. And one more click, please. And then here we have our wonderful Waianae Coast Comprehensive also doing their part, creating a flyer for their people. So just small kind, we wanted to show you what people are already doing, what our partners, the amazing work partners are already doing in the community. This is not all of that's out there. So I apologize if you're on, you're like, hey, how come they didn't put our flyer in their slide deck? Just email me and remind me, hey, put my flyer in your slide deck and it'll become in the slide deck. But we wanted to share with you just some samples. Next slide, please. All right. This is the Puanani specialty. I'll just introduce it by saying, actually, before we go here, Puanani, why don't we take a break and go to the chat and check for questions? Because from this slide, for the next few slides until we're POW, we're really going to talk about the health and the healthcare marketplace. So before we launch into that, let's just take a moment and make sure that we're responding to anything in the chat.
Meredith,
I do see healthcare coverage options at www.healthcare.gov. Was that a question or just sort of a statement? I'm not sure.
Sort of a statement, but we do have a question to help prepare families. Is there a federal poverty level for 2023? And do families with able bodies still fall under the 138% federal poverty level. Sorry, my mouth isn't working today. But anyway, so that's the first question that they have.
So yes, we do have new guidelines that have just come out. They will be posted on our website for April 1st, but they will be effective. Those FPL guidelines will be effective as of March 1st. They usually come out around this time of year, new guidelines. And yes, at 138th percentile of the federal poverty guidelines, individuals and families may be able to qualify for MedQuest. And for that, that income, so this current year, 2023, in March, that individual threshold is 1,929. So an individual making less than $1,929 per month may qualify for MedQuest. Say a family of 4, if they're making under $3,968, they may also qualify for MedQuest. And then for that same family of 4, if the parents may be working and maybe they don't have coverage for their children, but they have coverage for themselves, there's also that CHIP level of coverage that we have. So if their children didn't have any health coverage, that family could possibly be earning less than $8,999 per month, and their children might be eligible for CHIP coverage, which is the Children's Health Insurance Program.
So let's pause on that.
MedQuest.
Pause on that for a second, right? Because that's kind of a big deal to remember that the initial numbers, that's for the adults in the household, right? The adults are eligible if they're below that level. But for the keiki in the house, and what was that number for a household of 4?
Household of 4 for the CHIP or for regular?
For the kids.
For the kids.
For the kids for CHIP, so you could be making a household of 4 $8,999.
So that's basic. I'm going to make it easy and call it $9,000, less than 9,000. So it's good for us to know that and think about it when we're talking to our community members, right? Like, you know, Auntie, you might not qualify, but that doesn't mean your kids won't. So please answer the letter because it's important. You want to make sure your keiki stay covered. And they have that higher, they're not the 138, is it 303 or 308% of the federal poverty level for the keiki?
Yes,
For the keiki.
308, yeah.
And
one thing to remember, for that CHIP coverage with that higher income, they have to not, they can't, the children cannot have any other type of commercial coverage.
That's good
Then
to
they
know.
could possibly look at that coverage for them.
The second part of that question is the income still go off, or does it still go off of gross pay? So is it based on what they make
Yes, so
before
for those
taxes
who
or
are
after?
working, yes. Yes, so for those who are working, it is the gross income that family is incurring. Now, for those who may be self-employed, and there's a lot of individuals and families who are self-employed, it's their net income, right? So it's all of the income they've earned for whatever work they're doing, less all of their business expenses and deductions.
Okay.
So that
Awesome.
income. So again, we can help guide people through that process, because a lot of times people who are self-employed have a little bit of a difficulty in figuring out what exactly they need to turn in to be able to show what their actual income is. If they're up and current with their tax returns for their business, that would be helpful as well. We could use those things. Otherwise, we have ways and other forms to help them come to a monthly figure based on all of their business income and expenses.
That makes sense. Another question that follows up on this one. We live in multi-generational homes, and oftentimes our keiki start to work as well. Does their income get factored into this? And at what age would it not be factored into this? I know that's kind of an interesting question, but
It is.
how would that work?
You could still report it, but that their income would be exempt in that way. Again, once a child turns, so at MedQuest, are an adult when you are 19 years of age. So when you turn 19, you're no longer in a child category for Medicaid, and therefore we then look at that 19-year-old based off of their income and their household size. Of course, 19-year-olds could also still be a part of their parents' household if they're still a dependent, and then at which time their income would also be taken into consideration at that point if part of the family household.
That's
Does that make
awesome.
sense?
It does. That makes sense. And one of the things that I would say, as someone who was or still is a single mom of a disabled child, my greatest resource was my caseworker. And so a lot of the questions that you guys are asking, my suggestion would be make sure that you write these questions down. This is something that I was taught. Write these questions down, and there is no stupid question. So if you have a question, ask your worker. They're the best resource you have. If you don't have access to your worker for whatever reason, you also have the MedQuest website as well as the telephone number. And again, I would suggest giving them a call, reach out to them. If you're asking that question, I can almost guarantee there's somebody else asking that question, and there's probably an FAQ that is on the website that can easily answer that, or at least point you in the right direction. So, okay, next question we have. How about some community events around the islands / rural areas where workers can meet with the members where they live? Are you guys doing anything? I know as somebody who did a lot of COVID-19 vaccination clinics, mobile, we had to go out into the rural areas, not only here on Oahu, but neighbor islands as well. Are you guys going to be doing something similar, or is that something that you're putting on your partners?
Actually, we at our healthcare outreach branch have a very small team. So it's me, two healthcare outreach coordinators for Oahu, one outreach coordinator who splits her time for Hawaii and Maui County, and then the rest of us help cover Kauai. So we do actually do events and do outreach events, but we also highly rely on our community partners to help us. So there's two types of community partners, and I just want to kind of explain what we have. So we have community partners such as all of our federally qualified health centers throughout the state, who we work with on a daily basis. All of these community health centers have staff within their facilities that are their part of their duties is to do that eligibility, making sure they have access to coverage, helping them, providing them education and information on where they might be eligible and that kind of thing. And we work with them all the time. We talk to them all the time. We train them on an annual basis, usually in the fall. And we also continue training and guiding and helping them along the way all year long. We hold monthly statewide kokua calls, we call them, for all of our community partners. And so there, again, that's a large pool of community partners when you're talking about just our federally qualified health centers. Now, when you're talking about our contracted community partners, we're also talking about our kokua services contracts with organizations for Maui County, like Imua Family Services and Malama Ikeola. We also for Hawaii Island have Kumukahi Health and Wellness, and they have subcontractors under their contract with us with Malama Pono on Kauai, Health and Harm Reduction on Oahu, Maui AIDS Foundation in Maui, Kalani Hale, which is kind of like in the Miloli'i Ka'u Ocean View area of Hawaii Island YMCA, and it used to be West Hawaii Community Health Center. It's now Hawaii Island Community Health Center, which also includes Bay Clinic. And then, of course, we have Legal Aid Society of Hawaii, who is also the state of Hawaii's federal navigator for the healthcare.gov side. We contract with Project Vision Hawaii, who is so ingrained in the grassroots of the rural areas of our counties, right? So we have trained many of their staff to also understand how they can help clients in the community or members in the community who may need health coverage one way or the other with MedQuest or the health insurance marketplace. But they also do many other things too, right? SNAP, TANF, and Screen for Vision, and so many things. And then lastly, our last contract that we have is with We Are Oceania, who has all of their kokua are from one of one of our Kofa nations, Federated States of Micronesia, the Republic of Marshall Islands, and Republic of Palau. All of their kokua there, their first language is one of their languages, whether it be Chukis, Marshallese, Pashoyan, Pompeian, we have access to that. And as well as Legal Aid Society of Hawaii, and many of our organizations have kokua who speak various languages and things like that, because that was one of the asks when we put out our proposal for those contracts. So we have those types of contracts. And then we have just business associate agreements with other organizations who just want to help. We have organizations like Marshallese Association of Hawaii, One Stop Center for Micronesians on the Big Island. And that's just to name a few, but we have business associate agreements with organizations who are really ingrained in their communities and have that propensity to help, right? And they're respected amongst their communities, and people go to them for help. So there has already been a large effort. We've already been doing outreach for so long. So when we had to switch, with this pandemic, we had to go back to really grassroots efforts of outreach and things like that. And so we look to our community partners. We are so thankful for all of them because they really help all of our members. They add value to our members and to MedQuest because they're really the conduit between us and our members, because they're the ones who are out there meeting with our members every day. But that's not to say that our own staff at MedQuest aren't out doing outreach. In fact, on April 1st, 3 of us are going to be at various outreaches. Ku'u on Hawaii Island is going to be on the Kona side at a Micronesian celebration day. I'm going to be at the Papakolea Ohana Health Fair on April 1st.
Awesome.
And our other coordinator is going to be at a keiki fair at the Navy Exchange. So we do outreach where we can, and where we just don't have the capacity. We also really appreciate the fact that our community partners are helping to spread the word and help do that outreach as well. So
That's
hopefully
great.
that answers your question. So we have been doing it, and they really have been holding down the fort. They've been listening to us since February of 2022, where, everybody really wanted something more to say than update your contact information. But they have really stayed the course. They have, every month they're like, anything? Are we unwinding? What's happening? Is a public health emergency going away yet? And it's just like, keep getting those contact information. And they really have been doing such a wonderful job in making sure that all of the members they reach in the community understand, hey, if you move next month, come back and tell us, you know what I mean? So it's really going to be important in the future. So hopefully that helps.
I appreciate that. And I saw Meredith, did you want to add something to that?
I was just going to say, and we shamelessly invite ourselves to everybody else's parties. So if any of you have events coming up and you're like, oh, it would be good if somebody from MedQuest could come or a part, just let us know. We're same thing if you're having Zoom meetings, like we're happy to, as much as possible, try to be there to help support, answer questions. So don't be afraid or shy to invite us. We love to come.
I think that's awesome. Thank you guys so much. And I just have to say, a lot of the reason that we were able to get in touch with you is because we do work with a lot of your partners. So my suggestion would be, because we have a lot of CHWs here, we have some medical providers, we have community members. That was a long list that she gave. So what I would say is that if you didn't get down those partners, reach out to me and I will get you in touch with them. And that way in your area, if you're having an event, just like we did during COVID, guys, if you're having an event, if it's a truck event, if it's a craft fair, if it's a community health fair, invite them out, have them come out and talk stories, share their message. If you know that there's going to be a particular community involved, reach out to translators or interpreters and make sure that you have those languages available, which is so important. Which again, if you were keeping track of the list, which I tried to, but I'm not that quick of a writer, reach out to me. I can put you in touch with Meredith or Puanani, so that way they can get you in touch with the appropriate organizations or those that are closest to you, so that way we can do more talk stories like this. And no, guys, that's one of the reasons we wanted to do this today, was because while we get a lot of information and there's a little bit of misinformation, it's always best to go to the source. So if you can go directly to them, and this is something that we all hopefully learned in school, and I also learned when I was in college, this is something, go to the source. So I think that that's super important. And I also see that we have Amanda Stevens here. So I want to give her some time to share some of her mana'o as well. So Amanda, I'll go ahead and let you add to this conversation. Oh, you gotta unmute, sorry.
I was concurring with what you said about go to the source. And if you look at Meredith and Puanani, I mean, what better sources are there for our community, right? So, and Kim and I go way back. And Kim, thank you so much for keeping in touch. And Meredith pointed out to me that there was a question in the chat with regards to earned media. Do I have a couple of minutes to answer that? Okay, so earned media would be if we're reaching out to, say, the morning shows, and we want to make sure that we don't have to rely on if there's, you know, a traffic thing or whatever. So we would have that guaranteed time in the morning shows. We would also get some sponsored time for public service announcements. I know everyone thinks public service announcements are free, but oftentimes it's best to pay for some of them, and then you get more bang for your buck, and they give you maybe 2 or 3 more times. So that's what we're looking at right now. As far as TV, we're going to go for all of the stations. And we just really want to reiterate what Meredith and Puanani are saying. And not for people, if you notice, stay well, stay covered is all in the affirmative and positive. We don't really talk about losing anything. We talk about staying well and stay covered. We know that our members and people of Hawaii in general throughout the globe have been through enough, and we just want to help to make them feel safe and make them know that we got you. And with community partners like you, we can help folks. But that paid earned time is going to make sure, like our kupuna who watch the news at night, they get to hear this message as well. So thank you.
Oh, that's awesome. Thank you so much. So I'm going to get back to the questions, because I know an hour and a half or 90 minutes seems like a long time, but we're getting
We thought, oh my goodness, so much time. What are we gonna do?
So we have a lot of time, but we also have a couple more questions. So next they want to ask. So let's say somebody is going through the redetermination or the renewal process. Okay. And is there an in-between time where they would not be covered, or let's say they missed the deadline and they're within 30 days, but they get in the information? How long is it before they once again have coverage? I can go see their PCP or follow up with a doctor. Does
I'll
that make
take that
sense,
one.
guys? Okay, as long as that
Okay.
makes sense.
I think it makes sense, and it's a really important question to ask. So the first, my first response is going to be like, we really want people to get things in on time because we really, really, the operation, right, is the goal is nobody lose coverage, please, right? So we stress first, please return on time. We acknowledge things happen. What if they don't? What if they get terminated because we haven't heard back from them? We weren't able to reach them. We weren't able to renew them, but they're still eligible. So the good thing to know is they still have some time afterwards. So their coverage may be terminated. So say their coverage, it's one of the first ones, and we did in April send a letter. We tried to reach them, couldn't reach, we never heard back. The end of May, their coverage stops. So June 1st, they no longer have coverage. But they're like, oh my God, I forgot the letter. Okay, wait, I gotta go send it in. But oops, I went to the doctor on June 5th. And now it turns out I wasn't covered at that time. Oh no, what am I gonna do, right? So no, don't worry. Whenever you have the information, even if you're late, please send it in. We ask you to please send it in. Because when you do, then we can say, oh, okay, well, we terminated you, but you know what? Now that you got back to us and we can see you're eligible, we can renew and restore your coverage. And everybody has the opportunity to say, you know what? You're gonna restore my coverage, but can you make it retroactive? Because I had this doctor's appointment during that period when I wasn't covered, and I want to make sure it's covered. And we can go retroactive to make sure that that appointment is covered. Do we love to do it that way? Nobody loves to do it that way, right? But I just want you to know that there is that fail safe in there so that you can encourage people always. It's never too late. Even if you're like 6 months, gone, like, oh, I forgot. So now go apply again. By that point, we cannot restore. But if you still need coverage, submit a new application at that point, and we want to make sure you get covered. So I'd like people to know, never too late.
Awesome.
Right.
And then
And just to
go
add
ahead.
on that with Meredith, what Meredith was saying, if one did have to apply again, because they surpassed that deadline of really kind of for us being retro back. Don't forget, we also have that 90-day retro that we allow. So had someone, say they were terminated and they no longer had coverage as of June 1st. But they didn't know, and they in August they had to reapply, but in July they went to the doctor. They could still ask for that retro coverage back 90 days.
So do they have to ask for the retro coverage, or
They
is that
have to tell us
automatically?
what dates were the medical services provided.
Okay. So
Yeah.
guys, remember, you have to make sure that whoever you're working with, remind the member that if they went to see the doctor, using the scenario that Puanani just used, if they went to see the doctor in July, but they didn't apply until August and it wasn't enforced until August, they can ask for the 90-day retro, but it is on the member to ask.
Yeah.
So remember how
And
I
they
said,
need to
write down your
provide that date,
questions?
right? Because it's not
Yeah.
always just going to be the full 90 days. It will be to the date that you last had medical services.
Got it. So they need the date. So remember when I said, write down your questions before you go and meet with your caseworker, this would be one of them. And also make sure they write down the last day they saw the doctor prior to getting insurance. Here's a follow-up question for that. Let's say, okay, so they've applied in August. How long does it take for them to be approved? Like, how long is the process? Is it 2 weeks, 4 weeks, 6 weeks?
It could take 24 hours. If they did their application online, and when our system goes at night and bumps up against all the state and federal hubs, the very next day you could see an eligibility notice. So online is always the best way to do your application. But again, we realize that in rural areas there are difficulties, people don't have access. So again, there's also navigators, which are our community partners, our kokua in the field, who can help them submit applications, which again, if it's online, it could potentially see a determination of effectiveness by the next day.
That's awesome.
So again, paper is always slow, as everything is on snail mail. But if that's the only way, it could take up to 45 days.
And the more complete the application, the faster it goes. Like if all the pukas are filled in, then boom, easy, because everything's there. The ones that might take a little longer, like Puanani's saying, is like, oh, you didn't put your whatever in. We
You're
need that
missing some
information.
type of
Yeah, yeah.
information.
Right.
That makes sense. So
Right.
along those lines, there is some concern for those who have received an increase in their Social Security benefits and are now above the income limits, which you guys are all going, yes, we've heard about this. So the question is, what can we do to help our kupuna or our disabled who now exceed that the income
Eligibility
limit?
threshold. Okay, so I
Eligibility.
dealt with this
Yeah.
yesterday on my last thing of the day yesterday was this exact thing. And so I had to talk to one of our members in the community. She was very upset that she probably will be losing her health coverage. I totally understand. I mean, I understand that there, we have a high cost of living, not to mention that inflation is on top of all of that. But again, we have to go by our eligibility thresholds. We have rules and guidances that we have to follow. I did recommend that she contact our SHIP agency and speak to one of their coordinators or volunteers to see what they could do. I said, make sure, like for this one example, Auntie I was speaking to yesterday, when I looked at her case, I said, your renewal month is going to be in September. So you're most likely going to now lose your health coverage at the end of September. So what I would do is call SHIP now. I said, do you have a Medicare Advantage plan? She said, no, I don't. She said she didn't have one because she qualified for Medicaid. And then through the pandemic, her Social Security has gone up and now it exceeds the threshold, right? And so I said, well, good thing is, one, yes, you don't qualify for MedQuest, but you can stay on through September. And in the meantime, check with the SHIP agency, see what they can, what information they can provide for you. Ask them, is there a special enrollment period for Medicare where you can get onto an Advantage plan and that type of thing. So at least she has some time so she can explore her options. But anyone who's having those types of concerns who also qualify for Medicare should be checking with SHIP and seeing what they should be doing, when they should be looking out for, again, they should be looking out for when their renewal date is with MedQuest so that they know, because they know their income is too high, when they're going to possibly be terminated, so they can prepare what their next steps would be to have the appropriate health coverage in place.
That's awesome. So along those lines of eligibility, we do have international students who come here to go to school or go to college. And some of them get married and they may become pregnant while they're here. So the question is, what is available to them and who is able to qualify for MedQuest? Is it mom while she's pregnant and then mom and baby after baby is born? Or is there another configuration? How does that work?
As long as they're lawfully present and she is pregnant, mom would be able to obtain coverage if they met the eligibility threshold. Again, it depends, right, on the household size and their household income. So if spouse is making above the threshold, and doesn't have any health coverage, we may need to look at healthcare.gov as an option. So it really depends, but in many cases, in these kinds of scenarios that you did, students and things like that, if they're below the threshold or at the threshold, then yes, they could, as a pregnant woman who's lawfully present, could qualify for MedQuest. And then
awesome.
When baby's born, baby would be covered as well.
Yeah.
Awesome.
And something we always remind everybody of is just apply. I mean, it's
Right.
good to kind of have a sense of who might be eligible, who might not be. But what we really want to tell people in the community is if you are uninsured, if you don't have insurance, please apply for MedQuest. We want to make sure maybe you think, I applied 5 years ago and I didn't qualify, so I'm not going to qualify. Try again. You don't know. So we encourage everyone who is uninsured, please apply because we would much rather you be covered.
Yeah. And then
That's
taking
awesome.
it back to that pregnant mother as your example, MedQuest also has a 12-month postpartum. So in this case scenario, previously, before we had 12-month postpartum coverage, it was 2 months postpartum, right? And so
Nice.
now we have a year, 12 months
year.
worth of postpartum coverage. And
a
then
big
at that
deal.
time, that mother should be, possibly looking at either transferring to the health insurance marketplace at healthcare.gov.
Got it. That's awesome.
Yeah.
The secondary question, and it's two parts. What happens if they are not, so they don't have the right papers? They're not here, they don't have their green card or they don't have their student visa. Are they still able to apply? And then also, is MedQuest able to be a secondary insurance to people have insurance that's provided by their employer, but it may be they're considered underinsured because it's
So
like
we
the
have,
minimum.
yeah, couple of things there. So the first thing is you don't have to have your documents, like if you lost it, as long as you know what your numbers are. So like say you have a copy of something, because MedQuest will not request your documents unless we have to. So we tell people this about their social security card, right? We don't need to see your social security card. If you know your number, you just write it on your thing. And when we do the data bumps, as long as it comes back as verified, we never have to see your social security card. Only if we bump first and it comes back and there's a mismatch, then we would ask, oh, we need to see because we weren't able to verify it. So in that situation, it would be if they know their numbers, their immigration numbers, you can still apply even if they've lost their stuff. And hopefully when we do the bumps, it's verified because the numbers are known to the system and it comes back. On the off chance though that it comes back, and this has happened to us, right? Like, ooh, no match. And then people are like, oh, but I lost my passport and it's $800 to replace it in my home nation. And it becomes a more difficult situation to handle. So that's that one. The second one, yes, we have something that where Medicaid is always the payer of last resort. So you can be covered on your own with your employer, but if your income is still at a level that lets you be eligible for Medicaid, you'll also be covered by Medicaid. That secondary insurer, we call it TPL or third party liability, but it's basically, it sits there and Medicaid is the payer of last resort. So your regular insurance will pay first and then Medicaid will come around and catch the difference.
It's awesome. Okay, thank you guys so much. Hopefully last question. We may have some follow-ups, but data disaggregation has been a big thing during COVID. So we have seen it done. Hawaii is the only state that disaggregates Native Hawaiians and Pacific Islanders, and then Pacific Islanders into their subgroups. This was done during COVID and it proved to be very effective. Will MedQuest also be disaggregating this data, and will it be available to the general public? And the reason we're asking is because this is how our CHWs and our community-based organizations were able to go into these communities that we knew were being overly affected and address these issues. I know that's a big question, so anybody who wants to take it on, or who wants to answer it, please feel free.
I'll give you an answer that I wish could be more robust, but I want to at least address that we absolutely agree. Data disaggregation is critically important. We cannot understand our communities and the gaps if we don't disaggregate data. So we're completely in agreement and alliance with that. We're also in the middle of this big health analytics platform project that's bringing together data partners from across the state, from UH, commercial, all players in the space to come together in this disaggregated data way. So what I'm painting is the future looks really great. And then, you are where you are, and then you make your path towards that bright and beautiful future. So I can say that when people apply for MedQuest through Kolea, your identity, how you self-identify. So, right, it's optional. So we acknowledge not everybody will complete that data field. Not everybody feels comfortable or takes the opportunity to say who they are and what their ethnicities are. But when they do, we preserve that information. So that information is preserved to their case. So we're right now in the middle of like preparing for a lot of CMS reporting that has to go on and getting all of our data fields ready. So we'll take a look at what we can do in terms of regular reporting on this particular campaign by Pacific Islander, separate Native Hawaiian data to see if we're able to pull stats. I would love to sit here today and tell you, guarantee we'll get that to you by the 3rd of every month, but I'm not quite there yet, but I've already during this call sent a chat message to people on our data team to see what might be possible.
That's awesome. Thank you so much. And along those lines, does MedQuest cover, or what are your plans to address the needs of LGBTQ plus community members, especially as you are moving forward with the redetermination, but also collecting race data as well as gender data?
Yeah. So very, very good question. And I would say absolutely 100% equity, no difference between any LGBTQI family and any other family, right? This all treated equally and the same. And that our application, we are in the middle actually of changing the gender option on our application to have an area. We're looking at a couple different solutions. One is making the field optional. Another is adding a third party, a third choice. So that discussion has been ongoing. We need to get, whenever we change anything on our application, we need to get federal approval to make this change, and then we need to bake it in our system. But absolutely 100%, including our medical coverage. I just want to say, I know we're not talking about that today, but I just want everybody in the community to know that whatever is medically needed is covered.
That's awesome. Okay. Well, we have questions in the comments, but I want you guys to be able to get to your last slide because we are at it is 1:25. So I need to be wrapping up. But for those of you who have questions in the chat, please send them to me. So Atalina, Kahlo, send those to me and I will forward them on to Meredith and Puanani so that way we can get those questions answered. I'm going to turn it over to you guys to kind of go over the last option, and then we'll wrap it up after that. So go ahead, guys.
And I'll let you know this deck can be available to you because there's a few slides after this slides, but no, you don't need all of that detail here today. I think Puanani can cover the chunk of it right here.
Yeah. So again, what if someone is no longer eligible for MedQuest and they do not have access to employer-sponsored health coverage? So just a real quick, what does Hawaii have that other states don't have is our Hawaii Prepaid Healthcare Act. So for those who are employed, working 20 hours a week for 4 consecutive weeks, meaning in a row, if they're working these type of hours consecutively for their employer is supposed to offer them health coverage. They are supposed to offer that health coverage and pay for that health coverage. They can impose a 1.5% cost of their annual gross wages towards their health coverage contribution. But essentially the employer pays for their monthly premium and then does some sort of deduction with the employee to be able to implement that 1.5%. Their employers are allowed to ask employees for that offering of health coverage. Okay, so we have some of the most insured residents in the United States, and it's because of that Hawaii Prepaid Healthcare Act. Now, some people are working a lot of hours, but they don't work that at least 20 hours for 4 consecutive weeks. Then they would not be eligible to get employer-sponsored health coverage, and that employer is not required to offer that employee health coverage if that requirement is not met. So for those people, they can explore their options at healthcare.gov. It's called the Marketplace, the Federal Exchange, the Affordable Care Act, healthcare.gov. In
All the same
Hawaii,
thing.
in Hawaii, we are a federal, we use a federal exchange. There are other states in the union that have state-based marketplaces. So we are using healthcare.gov here in the state of Hawaii. So we send all of our residents there who need to apply. Now, the marketplace has created a special enrollment period of an entire year, right? So like from March 31st, or I think it's July 2024, the marketplace is allowing a special enrollment period for residents in our state and the United States who have lost Medicaid coverage due to this renewal process starting again. So again, some people may have remembered what the healthcare.gov prices were like prior to COVID, but I highly encourage everyone who needs to go to healthcare.gov, complete the application and see what you qualify. Look at what plans are available. There are a lot of affordable, very robust coverage plans on the marketplace, and they have made a commitment to continue those low premium plans availability through 2025. So again, a lot of affordable plans can be found there. Don't be scared about it, but understand what your what subsidies you are eligible for depends on what plans you want to pick, and also your health coverage. So again, if you're looking for help with that, you can also reference all of our community partners, because they are also, most of them are also certified on the marketplace as well, and we help guide them through that process as well.
I want to add just one thing, because some of you might wonder, like, oh, but what if a person doesn't know if they're going to be eligible for Medicaid, and they don't. So here's the thing. The good thing to know is our Medicaid program and the marketplace, they're connected on the back end. So if you apply on the marketplace and you tell them what your income is, they know what our standards are here in Hawaii. They're going to shoot your application back over to us and say, no, we don't want to put you on a marketplace plan because based on what you told us, it looks like you're eligible for Medicaid in your state. So that's great. So just want you guys to know that's a fail safe. So it's not like, oh, what if people go to the marketplace when they could have been eligible for Medicaid? So there's something built in to take care of that.
And the reverse is the same, right? So
Yep.
if you're no longer eligible for Medicaid, our MedQuest system, our CLIA system, they will transfer files to the marketplace. But that does not mean that the marketplace will complete the application. The member will still have to communicate with healthcare.gov either via their online account or by calling their phone number at the bottom of this page here, 800-318-2596, and complete that application, provide the pertinent information, confirm everything, complete the application, and healthcare.gov can then provide them with those options of what subsidies they may qualify for. Okay, next slide, please. Thank you.
No, all pow, I think.
Is it all pow?
Yeah, I
Next
think-
slide?
Our time is all pow.
I think we're all done. Yeah. Yeah.
Okay, so I just wanted to say thank you so
Yes.
much to Puanani, to Meredith, to Amanda for coming out. For me, this was very informative, as I know it was for our partners, because you answered a lot of the questions that we had, but also you gave us a lot of resources. So please look forward to us sending out another invitation. Ideally, what we would like to do, and we hope you guys are able to join us for our next one, is after the rollout, so probably 4 to 6 weeks from now, what we'd like to do is invite you guys back to have another talk story and to see how is the rollout going, with the first 35 to 40,000 people who received letters, how many of them responded, what help do you need, what assistance can we provide, but also I am sure that there will be additional FAQs as with anything, as it begins to roll out, all of a sudden, there's a little hiccup here, a little hiccup there. So how can we better help you, but also how can we support you in your efforts? So I want to say thank you. And then Calvin, if you guys can share, or Momi, we have our own little survey that we would like to, first off, of course, thank you guys. We have an evaluation that will be sent to those of you who attended today by email. So we would ask you, please complete that, send it back. Answer the questions, because as you guys have been able to tell, one of the things that we are doing as part of the 3R pivot is we are making sure that we're doing more webinars. We're getting you guys the resources that you need to serve your communities, but also to make sure that when you're out there, you're knocking on doors, you're having to talk story, that you have the answers. You can say, oh yeah, I remember today I was at a webinar and Meredith answered that question and this is what it is. Or I heard Puanani say, this is what they're looking at for 2023. So being those trusted messengers, being able to have that information is important to all of us. And we want to make sure that we are supporting you in your efforts. So please make sure that you answer that email, give us your feedback. And if there are other webinars that you would like to see moving forward, again, reach out to us and let us know. Next slide, please. We also have upcoming events. So for those of you who are able to join from March to July 2023 from 5 to 7, we have Wahine Wala'au, which is being done by Keola Mamo. So if you're interested, please reach out to your Keola Mamo CHWs, and they will be able to advise you of the location, and childcare will be provided. This Saturday, we have an in-person advanced care planning Talanoa session, which just means talk story. It will be held at the Kuhio Park Terrace Hospitality Room, Building B, and it is from 10 a.m. to 12:30. Lunch will be served. And if you guys remember, Kukua Mau was one of the partners that was featured on Meredith and Puanani slide deck. So they are out there, they're in the community, they're doing what they can. In this one, they're actually going to be talking about end-of-life planning or advanced care planning. So this is an important conversation for Native Hawaiians and Pacific Islanders. And this is a good way to ease our family members into it. Come, talk story, eat some food, get to meet with them and have just awesome time sharing and exchanging your experiences. The next thing that we have is Data Within Reach, which is centering Native Hawaiian and Pacific Islander communities. This is going to be via Zoom, and it is sponsored by the Native Hawaiian and Pacific Islander Data Policy Lab, which is out of California. So for those of you who are interested, please go to our NHPI 3R website. There is a link that you can click on and you can register there. That will be Wednesday, March 22nd. These are not sponsored by the 3R, but they are being held by our organization partners or team members. So we're making sure to amplify their message and get the word out. So that way, again, the community has access to these webinars as well as to these resources. Next slide, please. And then finally, we have our experiences with long COVID. So for those of you who are interested in attending, this will be our next NHPI 3R webinar. It will be hosted by Dr. Mary Oneha, who is with, who actually is the executive director for Waimanalo Healthcare Center. And we will also have Hohai Ryan and Charlie Isaacs, who will be sharing their experience with long COVID as Native Hawaiians. And we will also have 2 Pacific Islanders who will be presenting as well. So come talk story, spend your lunch hour with us. You can eat your lunch because you're not on camera, and then you can ask questions. I know that's something Puanani, Meredith, and I were hoping to do, but we didn't have enough to share. So, you know, it's okay. We're going to eat after this. But again, mahalo, mahalo. And we hope to see Meredith, Puanani, and Amanda Stevens as well. But thank you for coming and joining us and spending your lunch hour with us. And of course, to Papa Ololokahi, who is our the backbone of the NHPI 3R team, and to all of the NHPI 3R membership, leaders, committee chairs, and co-leads. Mahalo for joining us today, and we look forward to seeing you on the 30th. Thank you, everybody. We're going to go ahead and let you go for today. Mahalo, guys.
Aloha.